Hi, this is Emma Krasansky in collaboration with Dr. Christopher Steele, presenting Health Equity Teachers Module, Hispanic Health and Healthcare in the United States. The objectives of this module is that by the end, learners will be able to define the term Hispanic and describe its relation to race, ethnicity, and Latinx, describe the current demographic profile of the Hispanic population within the United States, explain how different social determinants of health shape the health of the Hispanic population in the United States, and summarize health trends apparent within the United States Hispanic population, including Hispanic health paradox and major health disparities for this community. So to begin, we have to define what it means to be Hispanic. But before that, let's just refer back to definitions for race and ethnicity, as in order to understand Hispanic ethnicity, you have to understand how it falls within race and ethnicity. So race is a socially constructed artifact that categorizes people based on visual differences, which are imputed to indicate invisible differences. So that's commonly indicated by physical appearance, mainly skin color or physical attributes. Ethnicity, on the other hand, is culturally based. So ethnicity refers to an individual's historical and cultural heritage. That definition is why Hispanic populations, Hispanic is considered an ethnicity. And so Hispanic ethnicity refers to native-born and foreign-born individuals immigrating from Latin America, the Caribbean, and Spain. And within this ethnicity group, this ethnic group, Hispanic individuals can identify as several different races within the same ethnicity group. They can identify as white, black, or other racial groups, which is one of the reasons why the Hispanic population is so diverse, which we'll get into. But Hispanic population, that label differs from the label of Latinx. They're commonly used interchangeably, but they do technically differ in their definitions, as the Latinx population is more specific to people that are of Latin American origin or descent. And so that eliminates individuals from Spain and the Caribbean within this Latinx definition. So now that we've have a better understanding of what it means to be included within the Hispanic population, let's take a look at the Hispanic population within the United States. The Hispanic population makes up 17.4% of the population, and it is predicted to increase to be 28.6% of the population by 2060. This makes the minority group the largest and fastest growing minority group in the United States. And while it's such a large minority group, you can assume that there's probably a good amount of heterogeneity within the large group. And this comes from several sources, one of them being that the individuals within the population come from several different countries of origin. Mexico, Puerto Rico, El Salvador, Cuba, Dominican Republic, Guatemala, and more. They are all huge contributors to the Hispanic population. As we learned with the definition, it can be any Latin American country, Spain, or the Caribbean that is contributing to this diversity. Another point of heterogeneity within this population is whether the individual is foreign-born or US-born. So we have individuals that have immigrated from their country of origin and come to the United States and are here, or you have individuals who are children, grandchildren, or other descendants from people that have immigrated to the United States, but they were born in the United States. And we'll see that there are some health trends that differ whether you are based on whether you are foreign-born or US-born. That brings us to that demographic profile of first generation, second generation, and third plus generation Hispanic individuals. And so 40% of the Hispanic population is first generation, meaning that they were the ones to immigrate from their country of origin. 28% were second generation, being a child of that initial immigrant, and then 32% are third plus generations, so grandchildren or further down the line of the initial immigrant. And that's important to keep in mind because, again, there are different trends for different levels of generations for the Hispanic population within the United States. Overall, the Hispanic population is a very young population compared to the general population, with a median age of 27 compared to the US population median age of 37. The Hispanic population is very young, 34.9% of them being under the age of 18 years old. This is important to consider as that enormous young population will begin to age and will affect our healthcare system. Now, this map just represents visually and numerically where there are large populations of Hispanic individuals. So this is showing the states with, based on their percentage of the population that are Hispanic. So we see large percentage of Hispanic populations along the Mexican border, as well as in Florida, a high amount in Illinois, as well as some states with high percentages within the northeast corner of the United States. That just gives you a geographical sense of where there is high concentration of Hispanic individuals, but it is important to recognize that there are Hispanic populations across the entire United States. Now, what I'd like to get into is a profile of the social determinants of health within the US Hispanic population. And why I want to take a look at this is because every Hispanic individual has their own experience, values, lifestyle. They are unique. So in order to treat them equitably with their health, you have to treat them as a unique person and treat them holistically. But before you do that, it's a good idea to get a sense of what the general trends are within the entire Hispanic population, so you're more aware of what this Hispanic patient of yours might possibly be experiencing, had been experiencing, etc. So this diagram right here gives you an idea of an approach, a conceptual framework to caring for a Hispanic population and what you need to consider. So as you can see, social determinants are right on here, and they're a huge factor of anyone's care in the United States, and that includes Hispanic individuals. So to begin with, let's talk about income. And so generally, we see that Hispanics have lower income than non-Hispanic whites. That their median household income was 52% lower than that of non-Hispanic whites, and that 23.6% of Hispanics were living below the poverty level in 2014. And this is disproportionately larger than the percentage of those under the poverty line within the entire population, as well as with non-Hispanic whites. And so what is this disproportionate amount of low income prevalence within the Hispanic population mean for that population's health? And as we go through the rest of the social determinants of health, we'll see that a lot of them are dependent and related to income. So having low income can potentially exacerbate an individual's problematic social determinants of health, whether it be food insecurity, housing instability, lack of transportation, being uninsured. There's so much that's dependent on an individual's income when it comes to their lifestyle, their health, and their health care. So it's a huge thing to be aware of. Another social determinant of health that we see trends within the Hispanic population is occupation. So while overall employment rates between non-Hispanic white population and the Hispanic population are very similar, we do see a different distribution of within different types of occupations. So 59% of Hispanics have unskilled, high-risk jobs, and that's much higher than the 38.1% of non-Hispanic whites that have jobs within that same category. And we see, as we get into more information on education later, that there is a trend. It could be related to education attainment levels, but this has a huge implication on the health of Hispanic populations as unskilled, high-risk jobs. There might be increased risk for, we see that it's associated with increased risk for mortality from specific occupational hazards. We also see that within the Hispanic population, or within migrant seasonal farm workers, it's a major population within that occupation are Hispanic individuals. And so because of their exposures to heat, pesticides, other chemicals, the heavy labor, we do see an increased risk of heat-related death and pesticide exposure within that population. So that's something to be aware of within the Hispanic population for trends. Now with education, we see, while there is improvement for these trends over the years, we still see huge disparity between Hispanic and non-Hispanic white populations in terms of education. So high school dropout rates are nearly 3 times higher for Hispanic populations in comparison to non-Hispanic populations, non-Hispanic white populations. And we see that only 15% of Hispanics had at least a bachelor's degree, which is a lot less than the 40% of non-Hispanic whites that had at least a bachelor's degree. So we do see lower educational attainment within the Hispanic population overall. In terms of healthcare, something to keep in mind is that Hispanics are underrepresented in STEM careers, and that includes healthcare, and there's a growing shortage of Hispanic providers within the healthcare field. What does this mean for the Hispanic population? With lower educational attainment, it exacerbates the likelihood for unskilled high-risk occupations that we were just talking about and the greater risk that they have for injury and exposure. The lower attainment for education fuels the income and poverty disparities that we've already discussed, and therefore affects other social determinants of health. And the lack of Hispanic population within the STEM careers and the healthcare field adds to the sense of mistrust that Hispanics may have with the healthcare establishment. Now, in terms of his environment, I'm discussing housing and where these Hispanic populations are living. And so we do see a de facto settlement trend of Hispanic immigrants into ethnic enclaves that are commonly in central cities and inner ring suburbs. And these may be because there's a lot of factors that drives this de facto settlement, whether it's income and financial ability, whether it's comfort with living with people of similar backgrounds when you're first arriving to the United States, whether it's that similar language, similar culture, that ethnic connection. We do see that de facto settlement. But because this de facto settlement is within central cities and inner ring suburbs, 91% of Hispanics in the United States live in metropolitan areas, 28.3% of them living near major highways with high traffic volumes. This urban exposure creates exposures to pollutants and carcinogens. It increases risk for respiratory illnesses, cardiovascular diseases, obstetrical complications, and poor pregnancy outcomes. And living in these urban areas, there are fewer structural opportunities for health behaviors, whether that be a place for children to exercise, play outside, run around, for adults to run, exercise, feel comfortable doing that outside. These also includes access to food markets and grocery stores that are sufficient and reliable for fresh, healthy food. There's a lot of health effects that come from someone's housing, and we see that within the Hispanic population. Additionally, we have 21% of Hispanics in the United States living near Superfund sites. And so these are Superfund sites are sites that have been classified as unsafe, potentially unsafe for individuals to live by due to their chemical exposures, pollutants, and carcinogens that are there and are then affecting these populations that are living nearby. all good things to keep in mind when you are considering the Hispanic population. Language is obviously a huge thing to consider with the Hispanic populations, as many of them speak Spanish, whether it's primarily Spanish or bilingually Spanish and English. Now, 68.4% of Hispanics reported speaking English at home or speaking English very well. Now, that's fantastic, but then that leaves 30+% of Hispanics that don't speak English very well or at home. And in a society that is primarily English-based and a healthcare system that is English-based, this creates problems for that individual in terms of health literacy, communicating with healthcare professionals, navigating the healthcare system, adhering to treatment plans and instructions for their health. And it creates a need for translators as well as bilingual providers within the healthcare system. So language is huge for these individuals. Like I said, in the demographic profile, immigration history is another important social determinant of health that you need to think about with the Hispanic population, as we have individuals that are first generation, individuals that are second generation, and individuals of third generation. So it's good to understand where, or if your patient is a first generation immigrant, second generation, third generation plus, get to know your patient. Because different generations typically differ in terms of language use, degree of acculturation, diet, and more. As families and generations become more established within the United States, the generations, as they continue, typically are more have undergone more acculturation into the English language, into the education systems, the workforce in the United States, an American diet that is higher in fat and lower in fiber, acculturation into the American sedentary lifestyle. We'll talk a little bit more about this when we get talking about the Hispanic health paradox, but it's important to understand that the length that an individual has been in the United States impacts their health. And we see this as second and third generation Hispanics have increased frequency of overweight and obesity compared to first generation Hispanics, and second generation Hispanics have higher rates of tobacco use in comparison to first generation Hispanics. Documentation status, like I said, is another point of heterogeneity within the Hispanic population. We have Hispanics that are documented as well as Hispanics that are undocumented. And so undocumented Hispanics make up 5% of the US workforce, and they are commonly employed in substandard high-risk jobs, and they're frequently with none or limited health insurance. Now, documentation status is commonly a very sensitive topic for those who are undocumented and probably even those who are documented. So your patients might not disclose this information, but if they are open and comfortable with discussing this with you, it's important for you to know if you can know it, because as undocumentation influences employment, they could be at risk for occupational injuries and exposures. With limited health insurance, they have limited access to the healthcare systems and preventative primary care. So they might be more likely to use emergency care services. They might be more likely to progress into severe illness rather than catching illnesses early. And they may be hesitant from seeking healthcare and trusting the healthcare establishment if they are undocumented. Now, insurance status, we see high rates of uninsurance within the Hispanic population. We see higher levels of individuals without insurance, both in states with expanded Medicare and non-expanded Medicaid after the Affordable Care Act. We see that Hispanic adults have higher uninsurance rates than both Black adults and white adults in both groups of states. And this is important to know because Clearly, health insurance affects an individual's access to affordable and standard care for their health. So it's important to understand whether or not your patients have health insurance or not. Now, we just went through a bunch of social determinants of health and what those look like for the general Hispanic population. And I talked a little bit along the way of how that can influence someone's health, the Hispanic population's general health. But let's take a deeper look at Hispanic health and healthcare trends. The first thing I want to discuss is the Hispanic health paradox. I just discussed how Hispanic populations are disproportionately exposed to negative social determinants of health, whether that's low income, whether that's poor housing, whether that's unskilled and high-risk employment, on insurance, on documentation, lacking English language. Hispanic populations face all of these social disadvantages. However, the paradox is that Hispanic populations live longer and have lower death rates from many leading causes of death, heart disease, cancer, and more, in comparison to non-Hispanic white populations. And so this confused and troubled researchers and health professionals, and still does as we continue to investigate it. But we see 24% lower all-cause mortality within the Hispanic population compared to the non-Hispanic white population, 25% lower death rate from cardiac disease, 20% lower age-adjusted prevalence for congestive heart disease, and longer life expectancy at birth for the Hispanic population. Now, after a lot of research and thoughts and theories behind this paradox, common reasons why it exists is because we already discussed the lower median age of the Hispanic population. The Hispanic population is young, which means they might not have developed or gone to the age of developing chronic diseases that cause death as abundantly as the older general population and non-Hispanic white population. Now, another major influence into the Hispanic health paradox is something called the healthy migrant effect. So a good, like we said, 40% of the Hispanic population are first generation immigrants. And so immigrants tend to be healthier than further generations, as well as non-immigrants and non-immigrants in the United States. And this is because they have chosen to immigrate to the United States. They may have had to pass certain medical exams depending on their immigration method in order to come to the United States. And because they have been in the United States for less generations, they have less acculturation into the, as I mentioned before, American lifestyle, American diet, the stress of being in the United States and being an immigrant in the United States, all of these things that would deteriorate Hispanic health for further immigrants allow for the abundance of first generation immigrants to create this Hispanic health paradox. Now, this paradox is not going to last forever. It's decreasing and is unstable because, like I said, as these immigrants remain in the United States and create roots here and have further generations of Hispanic citizens in the United States, they undergo acculturation. And so diet and level of exercises deteriorate over time as immigrants and further generations adopt our sedentary lifestyle and higher fat diet. We see higher levels of drug use, alcohol consumption, and smoking as further generations continue in the United States. And there's an immense amount of stress that comes with living in the United States as an immigrant and acculturating into the American society. This comes from relocation, economic pressures of supporting a family in a new country and finding a job, separating from your country of origin, your customs there, your social network, your family and friends there, language competency, learning a new language in the United States or existing without knowing the primary language in the United States, as well as the stress that is created by exposure to the discrimination that Hispanics face in the United States, as well as the ethnic slurs that they experience in the United States. Now, even though Hispanic populations overall, with this Hispanic health paradox, have lower mortality rates from major causes of death and longer life expectancies than non-white non-Hispanic white populations. We do see major health disparities that have been created and sustained through the Hispanic population and their social determinants of health as a population and as individuals. So we see that Hispanic populations are disproportionately affected by obesity, with 42.5% of Hispanic adults and 21.9% of Hispanic children currently classified as obese. And obesity predisposes and is a risk factor for several life-threatening conditions: metabolic syndrome, non-alcoholic fatty liver disease, diabetes, cardiovascular disease. So with this large of a proportion of the Hispanic population being affected by obesity, their health is at jeopardy. And another disparity, related, like I said, related to obesity is diabetes. So 50% of Hispanics will develop diabetes over their lifetime, and Hispanics are 50% more likely to die from diabetes than non-Hispanic whites, which is huge and something to be aware of. We also see a higher prevalence of chronic kidney disease and cirrhosis in Hispanics compared to non-Hispanic whites. Hispanics as a general population have an infant mortality rate that is similar to non-Hispanic whites. However, Puerto Ricans specifically have an infant mortality rate that is substantially higher than non-Hispanic whites. Hispanic populations are disproportionately affected by HIV and AIDS in comparison to their population proportion. And we see that as generations continue on in the Hispanic populations of the United States, US-born Hispanics are more likely to have worse health and health behaviors than foreign-born overall. An example of this is higher rates of smoking within US-born Hispanics compared to foreign-born, and then higher rates of hypertension within US-born Hispanics compared to foreign-born. Those are just two examples of the many health and health behaviors that are worse for further generations of Hispanics compared to first-generation foreign-born Hispanics in the United States. Now, in addition to health disparities, Hispanics also face disparities within the healthcare system. So their access, their treatment, and their involvement within the healthcare system that furthers health disparities that they have. So Hispanic populations have less access to health services, less utilization of preventative healthcare services. They have higher reports of delayed or lacking medical care, as well as not obtaining needed medications because of cost concerns. They have less follow-up care, and they are less likely to be treated for depression, anxiety, and other behavioral health problems. We see through all those examples, Hispanic healthcare differs from healthcare of non-Hispanic whites in the United States. And we see this specifically through evidence of being less likely. Some examples of this is that Hispanics are less likely to receive needed analgesia for operations and procedures, as well as less likely to have quality of life standard care, having that standard of care compared to within their treatment compared to non-Hispanic white populations with with certain operations. Now, in addition to treatment and access disparities, we also see that within the healthcare professionals, Hispanic individuals are underrepresented. So within all disciplines, pharmacists, physicians, assistants, licensed registered nurses, and dentists, we see low and disproportionately low rates of Hispanic populations within these occupations. Now that concludes the presentation on health and healthcare of Hispanic populations. I hope you have gained a good understanding of the overall trends, prevalent concerns within the Hispanic population. Next, we'll talk about how to take those into consideration when treating Hispanic patients and creating health equity for those patients within your treatment. Thank you.